Tuberculosis is a preventable and treatable disease, but remains one of the world's least infectious threats and a major global health problem. About 95% of cases occur in low and middle-income countries, but the disease remains a major public health concern in Canada, where it disproportionately affects Indigenous communities and people born outside the country. According to Health Canada, the rate of TB among Inuit peoples is roughly 15 times higher than in the general population. On World Tuberculosis Day, UT News examines how EPIC members University Toronto Emerging and Pandemic Infections Consortium are working to combat the disease, from developing better vaccines to better understanding financial burden TB on patients and their families. Better vaccines. The BCG vaccine has been used around the world since the early 1970s, and although we know there are limitations with vaccine, no one has come up with anything better, said Professor Jun Liu's doctoral student, Jacqueline Watt. Lab in the Molecular Genetics Department at U of T's Temerty School of Medicine. The vaccine is typically given to infants and is effective in protecting against rare forms of TB where the infection spreads to multiple sites in the body. However, childhood vaccination provides limited protection in adults against pulmonary tuberculosis, the most common type of disease affecting the lungs. This because it elicits a relatively weak, short-lived immune response and is based on a strain of bacteria that related to the TB-causing bacterium, Mycobacterium tuberculosis. Watt and colleagues address both of these challenges by developing a new vaccine candidate using IHPME tuberculosis. The researchers deleted a single gene from bacteria's DNA to make the disease-causing bacteria protective against disease, effectively removing its ability to cause disease. Early results are promising. In animal models of tuberculosis, vaccine candidates provided greater and longer-lasting protection than the BCG vaccine and induced a much stronger immune response. The next thing I want to do is look at why it might be more protective to see if we can learn more about which parts of the immune response are important for protection against disease progression, Watt said. Researchers in the Liu lab are also uncovering new insights into how tuberculosis uses molecules called small RNAs to regulate gene expression. They identified a protein they called SRB that acts as a chaperone to help small RNAs bind to their targets. While similar proteins have been found in other bacteria, such a protein has been identified for the first time in bacteria that cause TB. In a recent experiment, the researchers found that the SRB protein binds roughly 800 different small RNAs. Many of them have a role in key processes such as bacterial metabolism and stress response and could be good targets for new drugs to treat TB, which is sorely needed to combat the increase in drug-resistant strains of IHPME tuberculosis. Financial fee researchers are concerned that the financial toll of TB will have a greater impact on deserving groups that are disproportionately affected by the disease. We know quite a bit about the cost-effectiveness of various TB interventions in Canada, such as screening programs and diagnostic tests, but not much about direct patient costs and costs to their caregivers, said Lauren Ramsay, PhD, student at the Institute for Health Policy, Management and Evaluation at the Dalla Lana School of Public Health. Working with IHPME Professor Beate Sander, a senior scientist at the Toronto General Hospital Research Institute, associate scientist at ICES and Ontario Public Health, Ramsay colleagues recently launched an online survey of adults with active TB living in urban centers. The survey asks patients' caregivers about the costs they incur with their diagnosis and care, such as bus or taxi fare, parking, meals, missed jobs. Researchers aim to recruit 50 patients at 3 TB clinics in Toronto and 1 in Ottawa. Tuberculosis predominantly affects Indigenous peoples and people born outside of Canada. They offer translation services to ensure language does not become a barrier to completing the survey. From perspective of the patient and caregiver, we expect costs to be quite substantial as most people with TB have a mandatory period of isolation to complete. Depending on the type of TB and how well it responds to treatment, it can take up to several months in rare cases, Ramsay said. You can't go to work during this time and you rely on your network to support you financially. Ramsay will combine the results of the patient survey with estimated healthcare costs for a cohort of approximately 8,000 people with TB. Data from 2002 to 2016 will also allow researchers to look at whether people with tuberculosis are incurring higher healthcare costs over their lifetimes, even after recovering from the disease. Hopefully this study can shed light on where costs are highest for certain groups of people and stimulate discussion about services that can be provided to reduce worsening financial inequalities from TB, he said. TB is a critical area we need to focus on if we want to reduce financial and health inequalities. This story was edited and summarized. You can see the original here.